Hello, everyone. Myself, Dr. Parul Goel. I'm mother of a girl diagnosed with prader-willi syndrome at the age of 5. Now she's 13 years old. We had a late diagnosis. I'm also working as a volunteer for IPWS. That's the Indian Prader-Willi Syndrome Association, and that's a non-profit trust working as the parent support group. My journey as a mother of a child with the Prader-Willi syndrome has been a roller coaster ride. I have seen many ups and downs. The hardest part was establishing a diagnosis for the Prader-Willi syndrome because in the neonatal phase, the child has a difficulty to thrive, that the child is underweight. So every treating doctor usually never thinks of a Prader-Willi syndrome because usually doctors think that with Prader-Willi syndrome they associate obesity, and since at the time of birth, the child is underweight, so the diagnosis is really hard. And in the absence of diagnosis, early intervention is not possible. But in my case, since I have a medical background, so I seek help for the symptoms, not and I was not dependent upon the diagnosis. So we started off with the early intervention. We started with the physical therapies, and when she literally gained weight after the age of 3, when the hyperphagia sets in a child, I seek the help of endocrinologist because I was not able to control her weight in spite of the food interventions and dietary control. And moreover, the children with Prader-Willi syndrome, as with my daughter, they have intellectual disabilities compounded with the behavioral issues, and they also lack social skills. My daughter also lacks social skills, so they are shunned from the playgrounds and they are usually excluded from the peer groups. They don't have friends. Families also avoid social gatherings because of the hyperphagia in the child. So let me delve into the more details. Prader-Willi is a multidisciplinary disease, which is many with many I'm so sorry. Syndrome is a multifunctional disorder which often have many disabilities affecting children genetically. India is a nation with great heterogeneity and old age belief. Individuals with disabilities face social isolation mainly due to myths and misinformation about the disease. And also, there is a lack of awareness, and proper education has led people to think that disability as a karma. That means that this disease is a result of some past act or because of their fate. As in South Africa, disability here in India also is considered as superstition. Sometimes disabled persons are considered as inauspicious. They can be socially shunned. And people also consider them as a burden on the family. People usually resign. There is a resignation by the family. People develop a sense of resignation, and instead of seeking treatment, they believe that nothing can be done to change this situation, and that often delays the treatment. And in traditional Indian families, marriage prospects and family reputations are highly valued. So a disabled person is also considered a burden since the marriage prospects are very slim for a disabled person. And children with the disabilities, they are usually kept at home. They have no access to school due to lack of financial resources many times. Social judgments, family hide about disabilities, not and they don't seek social help, and any deviation from the normal are they are not easily accepted. Parents often go into denial, especially the fathers. They cannot come to the terms that my child can be disabled or they have any kind of disease. And all these things are especially true for the rural areas in smaller cities where the level of the education is very low. But now there is a shift in the mindset, and the people, and India is really breaking its stigmas. India has progressed both economically and socially. And there is an extreme, tremendous development in the medical technology, which has played a crucial role in changing the mindset of the people. India has willfully implemented the Rights of Person with Disabilities Act in 2016. This act increased the number of recognizable disabilities from 221 from just 7. And this is a big step which has been taken by India in doing the rightful approach for a person with disability. Due to this, Due to this act, there is equal rights in education, employment, healthcare, which marks a major change towards inclusion. Education and employment opportunities have increased. Many schools and universities now offer inclusive classrooms, assistive technology, special education programs to support the students with the diverse needs. Scholarships and financial aid programs to encourage children with disabilities to pursue higher educations also are provided by the government. Employment opportunities for individuals with disabilities have also been expanded. Despite all this advancement, the implementation of some challenges remains a challenge, majorly in small towns and in rural areas. And there has been modernization of the people. People have let go of their traditional beliefs about disabilities and they have started to evolve. And there is a growing awareness about the disability, and people now they don't think disability as a curse or a stigma, because usually stigmas are what stigmas are stigmas are basically a barrier for a person. They cannot have their fundamental rights, right to educate, right to socialize. And NGOs, government, and parent support groups are working hand in hand for inclusion of person with disabilities in the mainstreams. Now, diagnosis of prader-willi syndrome faces many challenges. Initial because initial symptoms mimic other conditions. Usually, pediatricians and neonatologists they think prader-willi syndrome symptoms like hypotonia and feeding difficulties they can be mistaken for birth asphyxia, sepsis, or other congenital disorders, and which can lead to delayed diagnosis. And the testing for the Prader-Willi syndrome that is very complex and expensive. DNA methylation testing is costly process, and it also requires specialized labs which are usually not present in the small tier cities and rural areas. Trained geneticists are also available in the bigger hospitals, which are present in the large cities like Delhi. Difficulty in diagnosis females, and also there is a very symptom variability. Features like obesity and behavioral issue develop very later, which can also lead to further delays in the develop, which can also causing delays in the initial intervention, and neonatal symptoms are not followed up. Oh, now I would like to talk about the obesity. This in particular is very misleading. India has long association with the food. Clinicians often underdiagnose it as a simple case of overeating, and parents are told simply to restrict food. Moreover, in India, children are not restricted to eat. It's our culture to offer more to a child. Parents often fail to recognize obesity as a major health issue. They think that obesity will always go away as a child will age. This thing, and this is usually told to mothers who are concerned about a child becoming fat, because in India, sometimes sometimes overeating is not taken as a taboo or anything. In fact, traditionally in Indians, we live in a joint families with the grandparents, and the grandparents play a very important role in managing the diet of the children. Indulgence in the treat foods. Usually, treat foods are high in sugar and fat, like sugary drinks. And grandparents they give to the children as an act of love or a core part of their grandparental role. They may also use food as a reward or to calm the negative emotions. Overfeeding. Grandparents or sometimes parents also tend to encourage children to eat more than what is necessary. It is a practice sometimes rooted in their own experiences where fat was associated with the health and the wealth. Usually, they consider a fatty child to be healthier. They don't consider it as a disease. And there are many misperception of a healthy diet. People usually lack updated nutrition knowledge, believing that a high energy diet is more nutritious and that childhood's obesity has no health consequences until the adulthood. And grandparents usually have a conflict with the parents. Parents may find it difficult to enforce rules when grandparents are present. Although this this all cannot be generalized, and grandparents, they can be instrumental in preventing the obesity by promoting eating healthy and daily activity. And we should also, grandparents can also help in creating a home environment where they support a healthy diet and daily activity habits. And moreover, they should be included in educational programs. This can improve their understanding of healthy eating and activity, which can lead to better outcome for the children. There is lack of awareness and guidelines. Also, in India, there is a need for the better awareness of Prader-Willi syndrome among healthcare providers and for standardizing the guidelines to, to promote early genetic testing. Pediatricians are usually the first doctors who examine the child when he or he is born. So there is a need for building their skills as they can help in the early recognition of symptoms. Dietitians must be familiar with the signs of high risk newborns. Pediatrician, they should maintain a high index of suspicion if a child presents with combination of Prader-Willi related symptoms, and they should arrange for genetic tests like DNA methylation analysis. And even before a formal diagnosis is made, a pediatrician should start with a multidisciplinary and developmental support care. And they should educate the parent, family, and they should do the counseling of the parents, because sometimes the parents, they go in a denial mode. And pediatricians are they are usually responsible for referring to the specialist and they should coordinate with the multidisciplinary team, endocrinologists, geneticists, orthopedicians, and the developmental specialist. And most importantly, they should connect the patient with the parent support group for emotional and the psychological support. All these factors lead to, and sometimes all these factors, when the pediatricians or a neonatologist or the treating doctor who is not able to see what are the symptoms of the child, all these factors lead to the delayed or the misdiagnosis, causing poor results of the treatment. And for increasing the rate of diagnosis, it is very necessary that we should educate pediatricians, neonatologists about the varied symptoms of disease through medical seminars. We should also increase the number of centers which offer genetic testing. We should set up mobile genetic labs which can provide services in the rural India, because these are the places where usually the patients go undiagnosed. And there should be creation of more awareness and education in regard to obesity and hyperphagia. Overeating is very important, which is to be avoided in children, because here in India, everything is associated with the food. Any auspicious occasion, anything, any family gathering, any marriage, everybody is just eating. Like, food is very important in our culture. And we have to create proactive rare disease help desks at the hospitals. Many hospitals in bigger cities, they already have these help desks. But if we create more people, we can counsel more people, and we can tap on the pregnancies only. More and more participation in medical conferences, especially pediatric conferences, and creation of educational videos where a celebrity can speak to create social awareness about the disease. And this can engage lot more of audience and create lot more of awareness. And most important, increasing the number of center of excellences in India. These are the specialized hospitals where genetic testing is done free of cost, and free growth hormone injections are provided to the patients irrespective of their uh, irrespective of their financial background. These hospitals, they are the mainstay for the treatment of the rare disease in India. And to conclude, I would like to say we have to ensure that awareness leads to the meaningful changes in everyday interactions, where we need to incorporate a holistic approach for integration of persons with disabilities in mainstream society, so that we can offer them a dignified life without feeling of alienation. Thank you.